If you or someone you know has been having problems with plantar fasciitis, inflammation on the bottom of your foot, and you're wondering what supplements should I wind up taking, this is the video for you. Also, if you know someone who's had problems with it, can you go ahead and share this with them to make sure they get the right info to take? I'm Dr. Gregg Gerstin. I've been helping people naturally over the last 20 years to help achieve a life of optimal health and well-being. And today we're helping people who have suffered with problems like plantar fasciitis. Now, plantar fasciitis is inflammation on the bottom of your foot. It can happen at a variety of different points in life, and it could really wind up becoming debilitating. Some things that I find that people can do at home that are super important is what I call some of the foundational nutrients. Plantar fasciitis is inflammation of the bottom of your foot. So it'd be really important for us to do some anti-inflammation for it. Now, I prefer to do things naturally, so I'm going to go over with you two of my favorite natural anti-inflammatories that should be a part of your everyday. So the first one that I'm going to grab is going to be your essential fatty acids. These are fish oils. Now, the ones that I love are Metagenics, EPA, DHEA, extra strength, enterically coated. Now, down in the message below, I'm going to have a link to these to make it easy for you to pick them up and for the people who you know who have it to pick it up. But this is going to be something that you're going to want to use to reduce inflammation. I've typically guided patients to wind up using about 1,000 milligrams up to 5 times a day, but this is going to be based off the individual. So don't take this for the word, but listen that that's what I typically recommend, folks. The second tool that I use for people to help reduce inflammation winds up being something that all people should be on. This is vitamin D. You know, I was just listening to an awesome podcast of an emergency room physician down in Southern California. And right now, Southern California is being overwhelmed with patients with COVID. And one of the things that they've been doing really early on is introducing vitamin D early to wind up reducing the inflammation and the inflammatory cascade that makes COVID bad. I've found and been recommending for patients of all walks, children, adults, to wind up supporting their systems with extra vitamin D so that they can wind up not just getting to normal levels, but being just beyond there to reduce the effects of corona, to reduce the severity of it. And what we're seeing now is it might even help you not even get it at all. If you've had inflammation though, this will help to reduce the inflammation in the bottom of your feet and get you back to being you. Vitamin D that I love is liquid. It goes right underneath your tongue. Me and my household, we've been using 10,000 IUs every day. Now, you want to make sure you get your vitamin D levels checked because it's easy to overdose on them. But for most people, particularly where we are in the Midwest, we're in the middle of winter. It's been dark since 3 o'clock. So we typically need extra vitamin D, but every individual is different on this. So make sure you get your vitamin D levels checked. But in most cases, people are needing extra vitamin D these days. And it'll really help if you had problems with plantar fasciitis. If you or someone you know has had plantar fasciitis, please pass this along to them. If you'd like it, give it a thumbs up and subscribe to our channel. Every month, we wind up taking on another challenge that people face, and we share with you why it's going on, what you can do about it, when you need to seek help, and what that help should look like. Once again, I'm Dr. Gregg Gerstin, and thank you for letting me be a part of your health.